Hello.
Hi, doctor.
Hi, my name's Dr. Radwan Ali, and I'm one of the doctors here in the GP. You must be Samantha Brown, is that right?
Yeah, doctor. Yeah.
Okay, and I understand that you're here about your child, Chloe, yeah?
Yeah, doctor.
Okay, can I ask, can you confirm Chloe's age, please?
Yeah, Chloe's 3 years old. Yeah.
Okay, and you are Chloe's mother, yes?
Yeah.
Okay, just wanted to confirm. Thank you so much. Well, how can I help? What happened?
Yeah, doctor. How's Chloe now? Where is she?
Oh, Chloe's with the nurse at the moment in the next room. We just wanted to find out a bit about the rash and everything that's happened. And I understand you wanted some advice as well. What happened? Can you tell me?
Yeah, actually, doctor, she was in the nursery. I don't know, but
Hmm.
they called me to pick her up because she
Right.
had this rash.
Okay. Okay. She's got a rash. Yeah. Do you mind walking me through the rash? Where's the rash exactly?
Doctor, actually, the rash was on her. Now the rash is on her face and to the body.
Hmm.
Because she was in the nursery, her attendant told me that it started on the face and then it spread it on the body, and that's why she was panicked and she called me.
I see. Okay, fair enough. So it started on the face and it spread around the body within hours, isn't it?
Yeah.
Yeah, okay. And how big is the rash? Or can you describe the rash in
It's it's just they're like the tiny rashes,
mm,
and there are a couple of them red in color. Some are yellow.
mhm.
Some have blisters.
Some are
And
blistering?
yeah.
Have you noticed oozing, a discharge?
Yeah, a few of them are
Okay.
actually losing. Yeah.
Okay. So obviously things have started suddenly and now they're getting worse and spreading everywhere from everything
Yeah.
you're telling
Yes.
me.
Yes.
Okay. In terms of symptoms, um, what kind of symptoms is your child having at the moment? Did you notice anything?
Doctor, she was actually like quite unwell for the last 2 days.
Okay.
She
Unwell for the last few days.
yeah. So she was
Okay.
just having fevers and she was under the weather, yeah, for 2 days.
Okay. Was it like a flu-like illness with a fever? Yeah.
Yeah, runny nose.
Okay. Fair enough. Fair enough. And how many days before this development of rash did the symptoms happen? You said a few days, but can I get a specific number?
2 days.
2 days. Okay. Okay. Thank you again. Now, has your child developed any chest tightness recently?
No, doctor. No.
Okay. Any shortness of breath?
No.
Okay. Any ulcers or swellings inside the mouth or rashes?
No, doctor. I don't know.
Okay. Okay. Has your child been, you mentioned obviously a flu-like illness, but I need to cover, any other kind of symptom. Is your child pulling at the ears by any chance?
No.
Okay, he's not pulling. Any shying away from light?
No.
Okay. Any diarrhea or stomach upsets?
No.
And any urinary problems like pain while passing urine, maybe?
No, doctor. No.
Okay. And the smell of the urine, is it normal, okay?
Yeah.
And the color's fine as well, yeah?
Yeah, she went up, yeah.
Good, good, good. Okay. And is your child hydrating well at the moment? Is your child drinking enough?
Yeah, doctor. I mean, she's quite unwell, but yeah,
Hmm.
she's good at it, but not
Okay.
eating well, but she's like having food, yeah.
Of course, of course. Again, thank you so much for answering my questions. It really helps me understand everything that's going on. Have you yourself, by any chance, given any thought as to what could be causing this rash?
I don't know, maybe it's an allergy because she was at the nursery. They're not telling me anything. Yeah.
Right. Fair enough. Fair enough. I did ask about serious allergy symptoms, and they're not there. So just to reassure you for now. But I'd like to obviously have a look at the rash quickly, and also just a few more questions about, when you were pregnant with your child. Were there any problems during pregnancy at all?
No, doctor.
No problems. Okay. And was the birth a normal birth or was it a vaginal birth?
It was
Sorry.
a normal vaginal, yeah. No.
Okay. Okay. And is your child up to date with all immunizations?
Oh yeah, doctor. Yeah.
Okay. And how's the nutritional status of your child? Is your child eating well?
Yeah, perfectly fine. Yeah. Before these 2 days.
Okay.
Very good.
And are you happy with the development of your child as well?
Yeah,
That's
absolutely.
amazing.
Yeah.
Okay, that's good. Yeah. Okay. So I think I've got enough information. Before I examine, do you have any pressing concerns or anything that you would like to address in particular today?
No, doctor, just I'm just worried about the rash because
Okay. Fair
she
enough.
was crying a lot, yeah. So
Okay, fair enough. Yes. So I'm going to check your child's temperature, and have a look at the rash as well. Um, I, So I can see it's very small pinpoints that are red there as well. Some of them might have popped and others not. Yes. Okay. So thank you. Judging from everything that I can see, it seems your child is having their first ever chickenpox bout.
Oh my God.
Yes.
Okay.
Yes. So chickenpox in children is quite common and doesn't lead to many problems. I think the most important thing is paracetamol for the temperature.
All right.
It's there and lots of hydration.
Okay.
Okay. So the thing about viral illnesses like chickenpox is they can run their course and they're not very severe in children.
All
Okay.
right.
And they go away after a few weeks. Okay. Now, usually it's most infectious perhaps in the first week and a half. Yeah.
Okay.
So any elderly people, anyone who's never had chickenpox, anyone who's got, serious medical conditions, please, 2 minutes remaining. Please, avoid having them around the child. Yeah.
Okay. Okay, doctor.
Okay. Just who else is at home, if I may ask?
Just me, my husband, and Chloe. Yeah.
Okay, that's good. That's good. Yeah. And have you both developed chickenpox in the past as children?
I don't remember, doctor. Yeah.
You've never had chickenpox before?
No, I don't think. No, no, no.
Okay. Okay, that's fine. Again, if you do develop any symptoms such as a rash, flu-like illness, we might be able to give you some medication to really reduce any severity of symptoms. Okay. If you've never had chickenpox, your child, there's a chance that it could have been passed on to you, but I wouldn't be so worried. Again, we can always give you treatment to reduce severity. Again, fluids, paracetamol, and the like.
Okay.
Okay. If your child gets worse in any way, please bring your child back. Okay. Very rarely, things can get serious, obviously, with any medical condition, but it's very low chance. I don't want you to worry too much about that. If your child gets worse, doesn't get better in the next few days, 2 weeks, please make sure you bring him back. Yeah.
Doctor, because I'm working, can I send Chloe back to the nursery? Can she go to the nursery?
So again, the infectivity period is within the first week. It's just happened recently, so maybe take your child off from school for the next week. Yeah.
Okay. Okay. Yeah, that's
Would
fine.
there be any problems or issues in that area?
No, doctor, I'll manage. Maybe I have to
Be able
take.
to manage?
Yeah.
That's great. That's great. And how's everything at home in life and looking after your child? How are
Yeah,
you coping?
that's fine. Yeah.
That's good.
Yeah, yeah, everything is balanced. Yeah.
Okay, so I'll supply you with a leaflet with more information as well.
Okay.
So again, yeah, I'm happy that your child is likely to be fine. I know that chickenpox can look very scary at times. Any questions or concerns about your child's health, about chickenpox, about spread, um, you can refer to the leaflet. You can give me a call. Move on to the next station.
Thank you.
Okay.
Yeah.
Okay. So let's
Yeah,
see
just
here. Mm-hmm.
perfect, Dr. Radwan. It was
Really?
just the nursery part. So always tell to keep the child at home.
Do I keep the child at home or not?
Uh, if I don't know if I
Is that
just
wrong?
that part. You keep it. Yeah, I asked you and you did it.
Hmm.
Yeah.
Yes. So infectivity is 1 week.
Yeah. So keep the
Yeah.
child.
So that's 1 week. Uh,
I think informing the nursery could is also one point if at all. They usually do it in measles, mumps. They
Informing the nursery, of course, of
you
course.
are going to inform the nursery.
Right.
Yeah. So you
Yeah,
take
yeah.
the details of the nursery because where she's going, you have to inform by yourself as a GP or doctor. So you're
So
going.
we'll inform the nursery. That's a good point. Please write it down, everyone. We'll
Yeah.
inform the nursery. Bilal asked, the child is with the nurse, so how can we examine at the time? So this is where they put a picture in there. Okay. They'll give you a picture.
So there is no.
Assume done, my friend. Don't
Yeah.
overthink it.
The children are not the actors.
Yes. Don't overthink it. Should we ask if mum is pregnant as she hadn't had chickenpox? Yeah, I think definitely. Is there any chance you could be pregnant? Is an important question. Yes,
Yeah, that was the point. Yeah,
for
yeah.
sure. Yes. So that's 2 points that we have. Management of itching is quite common. Yes, emollients, isn't it? Definitely antihistamines and emollients. If the itching and the nails, cutting the nails. Yes. Okay, so I'm learning a lot there. Thank you, guys. Really helpful. Good. Emollients, antihistamines, avoid itching. So cut the nails.
Doctor, do we mention MMR vaccine here in the chickenpox scenario? There's no need.
Yeah, we can ask about immunizations in general.
Yeah. So he asked, and there is a like, if the child is up to date. See, she's 3, so
Yes.
yeah, she is
She probably
immune.
asked if the mum was up to date with all her immunizations, eh? So I forgot the mum a little bit, didn't I, guys? So child should be at home till everything is crusted. That's good advice, yes. You know it's not infectious when everything's crusted over. What differentials did I exclude? Oh, so I asked for symptoms,
And
right? I asked for symptoms, I asked about immunization, definitely doing the observations in there as well. Because there's no swellings and there's no other illness other than that, sometimes, yes, if children are fully immunized, I don't suspect any other problem because they're not immunized. Sorry, because they're immunized and they're up to date with all their immunizations. So I'm not too worried about other things. Should we notify? No, it's not a notifiable, but you can notify the nursery.
nursery, yeah, it's important. Yeah, you do it.
Yeah.
They do it here. Yeah, so they
Yes.
definitely do it. Yeah.
Calamine lotion helps with the itching. That's correct. Cough coryza comes with measles. Do they come with chickenpox as well? Yes, it can come with chickenpox. And it's less likely to be measles when it's a child who's up to date with immunizations, but it's a very good one to ask about, definitely. So let's say, what can you ask? Swellings in the neck, definitely. Any eye symptoms, definitely. And so those are the areas you want to add, maybe, yeah? If you guys are really concerned about these there, swellings in the neck, which can still happen, and red eyes and things like that. But in kids, trust me, when they're up to date with immunizations, measles, we don't worry too much. Rubella, we don't worry too much. You usually have somebody who's never been immunized. Good. So I think next in line, what do we have? We've got a 50-year-old man who's made an appointment to see you. So Nida, you've made an appointment to see me.
Right.
And you've had a red lesion on your arm for the past month. Okay, so you've got a 1 month lesion here. Started gradually progressing, reddish in color. You're worried it could be passed on to the wife. Yeah? You're worried that it could be passed on to the wife who's pregnant 38 weeks. Okay?
Yeah.
I don't know why it says lesson. This would be lesion. Okay? No travel abroad recently there. So Bilal already knows what this is. I don't know how he knows. Did you memorize the scenarios? Huh? What if it's Lyme disease? Of course, yes, you're right. It's ringworms. Okay. So it's ringworms there. With this particular one, the management is the area that you don't want to mess up, I suppose. Yeah. What time is it? Let's see. It's 12:08. Usually, looks like Lyme. So we have to talk about the difference between Lyme and ringworms, isn't it? So I'm just trying to calculate the time here. So we'll probably go for our lunch break at around 1. Hey, my voice is killing me. 5 minutes. Can you give me five minutes? Literally, I won't go anywhere. I'll be sitting here, drinking water, resting my voice, and then I'll do this one as well. We need to talk about Lyme's disease and ringworms and how to differentiate. I promise you, it's very easy to differentiate. Okay, we'll talk about managements as well for each of these, and I'll review the chickenpox. I know I missed 1 or 2 things there. You guys caught that. So lovely. As you can see, another example of learning from each other. Lyme is a point of interest, I guess. It's a target, bullseye. We'll see it. 5 minutes, guys. See you. I've decided before that there was a discussion on how these different ones can look like, right? Remember, yes, it's true that it can be silvery, right? A ringworm can definitely be silvery, but some people, let's have a look at this one. Open the image in a new tab, right? So I just want you to know that sometimes this is what you could find, right? And here, it's not the standard silvery appearance, right? And so, yeah, it looks a lot like Lyme disease. However, when you look at Lyme disease, you need to know there's usually about 2 circles Lyme disease has two circles, okay? It's got two circles, okay? A lot of the time, it's got some clearance there and then boom, again, okay? So one middle circle and then another circle, very commonly in that way, middle circle and another circle. It tends to be much wider as well. So let me also show you from the slides here. I think I've got, there you go. See that? There's the clearance before a wider circle appears. All right? So that's something to consider right there. Thank you, Salman. So in your history, again, you've got to differentiate it, okay? You've really got to differentiate it in your history as well. So we'll talk about that in a second, okay? There you go again. I know this can look like Lyme's, but usually Lyme's has a middle area that's red, then this kind of clearing, then a bigger one. So look at that, and then look at that. So if you leave out the big circle and you put that in the middle, and then you go here and you see your history is very important as well. So we're going to do this one with history taking as well. In any case, it is also common to see silvery scales on the edges. Yes, silvery scales on the edges make life easy, but you know, you're always going to make sure that you take a good history, including traveling, hiking, going to forests in there as well. Yeah, so that's an important area to look at. So I really can't wait till lunch comes because I'm so hungry at the moment. Am I sharing my screen? No. Here you go. Let's go for it. Timer ready?
Yeah.
Here we go. Hey, if there's anybody who is feeling it now that we've done so many back to back to back, right? Please feel free to do a scenario. Okay. Just raise your hand and maybe I can be the patient. We've got Mariam joining us later. We've got more doctors joining us later as well. Simulations. Good. Thank you so much, Nida, for being around. And we've learned a lot from you as well. Let's go for this one. Are you ready?
Yeah.
Okay. Begin. To the room. Hello.
Hi, doctor.
Hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the GP surgery. You must be Tom Brown, is that right?
Yeah, doctor.
Okay. Can you just confirm your full name and age, if you don't mind?
Yeah, Tom Brown, and my date of birth is 17th November 1974.
Okay, thank you so much. That's very helpful. What can I call you today?
Brown is fine.
That's great. Nice to meet you, Brown, Mr. Brown. What seems to be the problem today?
Doctor, actually, I have a lesion on my arm.
You've got a lesion on your arm. Okay. And where on your arm exactly? Is it the forearm or the elbows? Or
No, it's actually on the forearm.
it's
Yeah.
on the forearm, yeah? Okay, okay. How many?
Just one, doctor.
Okay, just one. Okay. And could you maybe tell me how big you think the lesion is, or the
I would say like 3, 4, 5 centimeters.
4 or 5? So okay, pretty big, yeah.
Yeah, yeah.
What color is it?
Doctor, it's like a mix of color. Like it's reddish on the outside and a bit lighter pink on the inside. Yeah, light pink.
Yeah, okay. So it's reddish on the outside, lighter pink on the inside. Can you tell me how long you've had the rash for?
It's for 1 month now, doctor. But it's spreading. It was very tiny when it started, and now it's just that big.
Okay, so it's tiny, it got bigger
Yeah, yeah,
the last month.
yeah.
Okay, and when it got bigger, how long did it take for it to reach its bigness? Was it within
It was
days or?
slowly, doctor, over the past 1 month. It was like slowly increasing in size. Yeah.
Okay, so things have just been happening gradually and they're
Yeah,
getting
yeah.
bigger. Okay, fair enough. Okay, and did you have any symptoms at all before you developed the rash?
No, doctor, I was perfectly fine. Yeah.
Okay, okay, no flu-like illnesses or anything like that.
No,
Okay. And you mentioned that it's getting bigger, but by any chance, has it changed in color much since it began or in any other way?
no, doctor. It's
Okay.
like,
It hasn't changed in any other way. Good. Just a few symptoms. I know you said you didn't have any flu-like illnesses or anything before the rash began, but the rash itself, is it itching?
yeah, doctor, it's quite itchy. Yeah,
Okay, it's itchy.
yeah.
Okay. And is it by any chance blistering or bleeding?
No, doctor.
Any change in sensation?
No,
Okay. Any discharge at all?
no, doctor.
Okay. Is it scaling?
A bit, yeah, but it's quite itchy. Like I have to scratch it all the time. Yeah,
Right. It's itchy. And when you scratch it, do bits come off? Yeah.
yeah, yeah.
Okay. Fair enough. Okay. Thank you. That helps me a lot to understand what's going on. Do you have any medical conditions at all?
No, doctor.
Are you on any medication?
No,
Are you allergic to any medication?
no, doctor.
Okay. Do you have any allergies to any medication? Sorry, I just asked that. I apologize.
Oh, no,
Are there
that.
any conditions that run in the family?
No, doctor.
Okay. May I know what you do for a living?
Doctor, I work in a bank.
Okay, you work in a bank. Okay, great. And in terms of the rash, has anyone in the family developed any similar symptoms?
No, doctor, but that's why I'm here. I'm just worried that I might spread it.
Okay, you're worried that you might spread it. Fair enough. Once I have a look as well and I assess it visually as well, I'll be able to answer questions about infectious nature. Yeah. Okay. Is there any chance you've traveled abroad recently?
No, doctor.
Okay. And have you gone camping or hiking, gone to a forest?
No.
Okay. And may I ask who else is at home? I know you're worried about, having the infection passed on.
Doctor, actually, my wife is pregnant and we're just hoping like soon. She's 38 weeks pregnant and I'm quite
That's
worried
amazing.
about my wife and the baby.
You must be very excited and quite worried, isn't
Oh,
it?
yeah. Yeah, yeah,
All right,
doctor.
well, firstly, congratulations. And secondly, please,
Thank
um, you know, I'll definitely address that. And I can see that you're worried about your wife getting the rash and if it can be passed on. So we'll definitely get into that. Other than that, have you given any thought to what the rash could be?
I don't know, doctor. Is it an infection or something?
Yeah.
I really don't have any idea.
Okay. So I'll just quickly examine the rash and check your temperature as well. Make sure you're okay and that you don't have any temperature and check the rash as well. So just having a look here. Right, I can see it's red and it's circular as well. Right. Yeah. So thank you for allowing me to examine you. I've looked at the rash and I've asked you the questions, and I suspect that the cause of your rash, it really looks like ringworms at the moment.
Oh, what? Okay. Okay.
Yes.
I might
Um,
add it,
have you
right?
ever heard of that?
Yeah, yeah, doctor. Like I know it's fungal infection.
Yes. It's a fungal infection, and unfortunately, it can be passed on to people.
Oh,
Okay.
is it like, can it harm my wife? Like, she's pregnant.
No, it wouldn't harm your wife. It wouldn't harm the baby either, but it can be passed on. So just general hygiene measures I want to talk about, as well as treating it as well.
Okay.
The treatment duration can be up to 4 weeks.
Oh,
Okay,
okay.
I'll prescribe you an antifungal cream. It's a fungal infection in nature. Okay,
Okay. Okay.
how do you feel about that? You do, yeah.
Will the itching go away as well, doctor, with the cream?
Um, the itching may last for a bit,
All right.
but
Okay.
eventually it will go away.
Oh,
Okay.
okay.
You just apply the cream 3 to 4 times a day for the next 4 weeks.
Oh,
Okay.
okay.
And 2 minutes remaining. There is the potential for the itching to persist during this time, but things should improve in about 4 weeks. If not, please come back so we can have a look. Okay.
All right. Okay.
In
Okay.
terms of hygiene measures, you know, the ringworms themselves, you can get it from multiple places. You could have touched somewhere that, was infected and then it could have passed on to you. It could come from soil and dirt. But most importantly, if you do have it, just, generally not sharing towels, not sharing clothing, washing the sink and the bath after you take a shower. So, you can minimize the risk of it going to someone else through these means. Yeah.
Okay. All right.
Okay. You can also make sure you change the bed sheets regularly as well, things like that.
All
Okay.
right. Okay.
Okay.
All
If
right.
by any chance it's passed on to your wife, we can start her in treatment as well. But you can reduce those risks by just washing your hands with soap and not touching and scratching it as well. Yeah.
Right. Okay, doctor.
Flakes, they can go to other parts of the body, and that could just spread the rash on your body as well.
All right. Okay.
You haven't got any other rashes anywhere else, have you?
No, no, just on the forearm, doctor.
Okay, that's good to hear. All right then. Thank you so much for answering my questions. Do you have any other concerns or questions at all?
No, doctor. That's
Yeah.
it.
Okay. Is there anything else you hope we could do for you today?
No, thank you, doctor. Thank you.
Thank you very much. I feel like I missed something here.
No, it was like you covered everything well. I think this was a very short station. Sometimes.
Stations can be short, yeah?
Yeah, yeah, they can. And you covered like the hygiene thing. So
Yes. I had the same lesion in exam, and patient said he takes the dog out for a walk, and I said it's Lyme, and I got 12 out of 12. Well, there you go, my friend. If you take out your dog for a walk, and that is basically going to be a tick from Lyme's, isn't it?
Move on to the next station.
Yes. That's good, yes. You did the right thing. I think Lyme's disease scenario is coming as well, Musarrat. So we'll talk about that as well. So there you go. How long after treatment does it stop being infective? The infective period is usually, I'm going to have to double check that as well. Dr. Nida, the infective period for infective rash to ringworms, how long is that usually? Do you have any idea?
I'll check. I'm not sure.
I haven't had to look at that. Also, my sugar levels are running low, it seems. I thought we were going to keep going till 1, but I think I need to eat lunch as well, non-stop.
Up to 2 weeks.
2 weeks, isn't it?
But the itching doesn't go away, so you have to like tell about the maybe the itching can
Yes.
last longer.
It lasts for up to a month. So 2 weeks there to give you the accurate answer for how long it becomes infective. Musarrat, definitely, you did amazing, isn't it? That's a risk factor. Dogs going out. Where did he take the dog for a walk? In the forests? Okay, after lunch, I'll start with describing I'll start by describing the difference between Lyme and fungal. A Lyme disease scenario is coming later. So when we do that, then we can talk about that as well. So Musarrat, yeah, tell me, did he tell you where he took the dog out for a walk?
I mean, definitely the scenario we were doing,
Okay,
it
1 week ago, yeah?
yeah, and it was more like a ringworm. So it
Mm.
depends on the scenario to
Yeah,
scenario.
duration is like a month, and it's itchy and it's got the scales and the silveriness.
Yeah.
So yeah, they really did it nice. Okay, well done. You caught that one because I think important to know where they took the dog as well, isn't it? But generally, well done to you. You got 12 out of 12. That's fantastic. I'm sorry to hear that your first time didn't go well. So I'd love to hear what happened there. We're gonna take a break. Hello, everyone. Dr. Mariam is here as well. How are you doing?
Hello, I'm good. How are you?
Good, thank you. Very, very good. So, thanks for joining us today. We've been doing dermatology, a bunch of dermatology, the history taking there. Key takeaways for history taking when it comes to dermatology, guys. Definitely to ask about the rash's size, color, the onset duration, and things like if it's getting worse, if it's got, changes. And if there are any changes, how quickly these changes happened. Then you want to ask about any symptoms before they, develop the rash, prodrome symptoms. And we want to also sometimes ask about symptoms in detail. Okay. So usually you're okay to do a quick systemic review, fever, myalgia, joint pains, headaches, neck stiffness, being unwell in any way. You have to do that too. Good. P. maftosa. If it's a child, you do your PAM good and your P bind examinations. Some will obviously need special tests if, for example, you suspect Lyme's, and we'll get to that. And some, they are a visual clinical diagnosis. Even Lyme's can be diagnosed clinically as well, unless it's, atypical. So we'll quickly go through some of those guidelines later as well. But other than that, I think since we've been, doing a lot of practicing, we just keep it going the way it's been going. Urticaria is a new onset rash in a child. And I do believe that this is a rash that comes and goes. So, a common question could be, is it meningitis maybe? Or is it something that will keep coming back? Well, yes,